online, you go to the homepage or to the app, okay, and you book a time, okay, the availability of that doctor, and then you write this information, your name, your email, and some information like your chief complaint, and for some, there are additional information that they require. And then in within the day or within the next 24 to 48 hours, you will get a response from the secretary if your consultation is booked, and they will send you an hopefully an informed consent and other details pertaining to your uh, e-consulta or consultation booking. And then for the patient, you just have to be there on time, okay, for the consultation, because normally doctors would schedule about 30 minutes per patient, and they would move to the next patient after that. Okay, so normally they will have only morning for their e-consult, and then the afternoon or will be devoted for their data recording. Okay, so it's very easy, and this is just an example of the platform where you can do booking for your consultation. Okay, so that's about for the Philippines. I because most of the participants are from the Philippines, so I'll just go very fast about the Singapore and the US experience. Okay, so in the start of the pandemic in Singapore, okay, the Singapore Medical Association came out with an algorithm who can go for telemedicine and who needs an urgent care, or who needs to go to the A&E. Here we call it A&E. It's accident and emergency. This again, if you want this information, I'm happy to share this information. This is given, and this is also available in the Singapore Medical Association homepage. But just to highlight to you that there is an algorithm who can go for telemedicine and who are not qualified for telemedicine, obviously because it is an emergency case. Okay, so they also came out with the LEAP, okay, program. This is licensing, experimentation, and adaptation program, and this is the directive of MOH. So that's Ministry of Health, as opposed to Department of Health in the Philippines. And together with the National Telemedicine Guidelines, they came out with guidelines for doctors who are wants to practice, or who are already practicing telemedicine. So very easy. They have a sort of an online platform. You go for this training. Everything is online, and once you're done, then you can. It gives you an information how to practice telemedicine, and it's very helpful. And then you can practice telemedicine. Again, in Singapore, the practice telemedicine is basically you have to have a SMC registration, that's Singapore Medical Council registration. But I think they added recently that you should have an online training, okay, an online training on how to conduct telemedicine. And again, I mean, regulation has benefits, but if it's too regulated, then it also discourages people or doctors to get into this platform. And if they are discouraged to go to this platform, then the effect of the patient to the patient, they might not be able to reach their doctors. Then for the regulators, this is something that they are very careful about, not to heavily regulate it, but to help those who want to start their practice remotely or through Tele-Konsulta. Okay, so when they came out with the regulation, they consulted the different association, the different specialty groups, the different private practitioner of medicine, and they even asked some international uh, consultant on the practice of medicine, because in some other countries might have more experience than Singapore, so they ask consult from other countries. Okay, I think I'm aware of the time, so I'll just hurry up a bit faster so we have more time for Q&A. This slide was shared to me by Professor Tan of the Duke NUS. This is one of the medical school in Singapore. and it's just show you the different medical discipline with tele-treatment or tele-support or tele-consulta practice. Okay, so I won't go into detail with that. I think they just want to emphasize that if you are going for teleconsult, please check for security setting and use the right platform, okay, that has encryption. Okay, so before I leave Singapore teleconsult experience, they do have an app. Okay, so this is for those who are Singapore or who have traveled to Singapore or who has partner in Singapore. I'm sure you're familiar with the different hospital here, like it's all acronym like CGH, Changi General Hospital, NUH, National University Hospital, KKH is also one of the hospital here in Singapore. They came out with a Health Buddy app, very easy, similar to what I just showed you. You manage appointment, you click appointment, you book the doctor 2 to 3 days in advance. Usually you have to enter with a SingPass. This is sort of a national identity that you have very secured, and you request an appointment, and then you show up for your appointment. Okay, so telehealth in the US, okay, these are done by nurses, not just doctors, but nurses and clinical psychologists and licensed clinical social worker. Okay, what I want to highlight on this slide is that in the US, okay, doctors, okay, or licensed healthcare professionals giving telehealth service are paid under the physician fee schedule at the same amount as in-person services. Okay, so are paid under the physical fee schedule at the same amount as in person. So I think that's quite significant. I did some research on this. PhilHealth currently in the Philippines hasn't started paying doctors doing teleconsulta, but I think this is something that maybe those who are involved in this practice, okay, and those lawmakers, it's something to discuss about. Okay, essentially for others, it can be a call of for action for our lawmakers to discuss this in terms of our healthcare services. Okay, so they came up with a grant to the hospital, clinics, health centers, and educational institutions to activate more telehealth programs. Okay, so I've written here my source under the Federal Communication Commission. For the interest of time, again, you can go through it on your own and see the telehealth programs that are available or being promoted in the US, especially in the time of the pandemic. Okay, as I mentioned, for those who are latecomers, this is by no means endorsement of this platform. TalentDoc is one of the platform for Americans and even non-Americans to use to get virtual care provider. Okay, so I was just impressed at the data that they have, that they completed about 4.1 million virtual care visit in 2019. I can imagine in 2020 with the pandemic, this amount of virtual care visit can easily double or triple. Okay, so I think I talked about, or I've seen you a doctor earlier who is using this platform, and here I want to talk about, there are different platforms available, and some of them are on subscription. You subscribe, and then you pay a certain amount per month, so then they can maintain your telemedicine sort of logistic or practice, whether it is your booking of your schedule or whether it is doing electronic medical record. Some of these subscription have level, okay? So you can have the free, you can have the premium, and as you go from premium or higher subscription, then you have more services that are offered by this platform. Okay, so for Sirius MD, I've checked this, and then you pay a specific amount. If you are migrating from the free version to the premium version, then there's a specific amount that you pay to maintain your presence in that platform. For Medifee, if I'm not mistaken, this is sort of a sharing per patient that you see. So the payment for this platform depends on how many consult or teleconsult that you do for that particular timeline. Okay, so again, there are many iteration or variation of this subscription. for somebody who is about to start, okay, please do check them, okay, and counter check, and also check other platform that might be the best in your situation. Okay, so Zoom, I think very popular now. We are in Zoom, but as I mentioned earlier, there is some issue with security. I think they hired somebody from one of the executive of Facebook to improve the Zoom security, and I think they're starting to roll um, more security features. I think yesterday or last night I was just prompted to download the Zoom 5.0 version. So then I think that is like forcing people to, at least if you're using Zoom, to adapt to a higher platform with higher security. I just highlighted here HIPAA security compliance for those who are US based or have relatives in the States. This is basically our Privacy Data Act of 2012 in the Philippines. If you're in Singapore, that's what we call PDPA. Okay, so HIPAA or HAPAA is a US-based sort of security compliance. So if you're using a platform, it has to be compliant with them. But again, with the pandemic, I think the regulators have relaxed some of the rules. I don't know what they'll do after the pandemic, but again, they allowed non-HIPAA compliant platform to be available, because this is in the notion that we want to help more people and want to reach more people. Okay, but just be aware that there are platforms that are PDPA or Privacy Data Act compliant or HIPAA compliant if you're in the US. Okay, so the benefits of telehealth for locals and expatriates, okay, are listed here. It's convenient, cost saving, it's flexible, and even some of these platform are 24 hours available for medical advice. Okay, so but again, my advice is to please book your appointment 2 to 3 days in advance. So then the secretary or the medical assistant or the one who's doing the booking can, normally what happens is that you have some interaction first on the email after your booking. So then the doctor assistant can train you or assist you on how to set up your video conferencing. So when the doctor comes on the time and date of your consultation, then this is all set up. Of course, there are always gonna be an IT issue, even though you practice this IT platform. Okay, there will always be an IT issue. Okay, so I just came across with this blog, and this is a doctor, an American doctor who's based in Barcelona, who's practicing telemedicine. And I think when I finished this blog, it made me think, wow, after he's overseas, he's in a he's in a good place or in a good country, and after his telemedicine consultation, he just walk outside of his apartment and just go to the beach. Okay, so something that I think more and more we'll see people considering this telemedicine traveler. Okay, so it's not for everyone, but I think Dr. Bill, that's not his real name, it's something to think about, the options, okay, for a lot of doctors who might want to practice telemedicine traveler. Okay, I'm on the last few slides. I think part of the coverage is how to establish a platform or a teleconsult platform. But one of the important necessity, okay, for establishing a platform for teleconsult is the internet speed. And this is a data from Southeast Asia, okay, and shows the average speed of internet. Okay, so in Singapore, this is 70 as of 2019, but it's definitely way more than 70 Mbps. Okay, if you look in the Philippines, that's the average in 2019 is about 5 Mbps. And I'm sure some of you have some trouble with the IT or internet speed. They will say, or they will promote the ISP or internet provider will say it's up to 20 Mbps, but in reality, the term there is up to 20 Mbps, but sometimes you don't reach that. Okay, and if you have people or if you have family members who are using the internet at the same time you're using, okay, your bandwidth and your speed is even reduced to half, if not a third or a fourth, depending on how many members of your family are using the internet at the same time. Okay, so these are practical tips in setting up your teleconsult. Okay, make sure that your internet speed, if your teleconsult is 2 to 4 p.m., ask your family members not to do or not to use your internet from this time, so you can have a more a faster speed. I mean, so to speak. But I guess if you're in the U.S. or in some country in the city in the U.S., of course, some places in the U.S. like the rural America, some areas also have intermittent speed. Okay, then it is also something to consider in terms of internet speed. But like in Singapore, quite fast. Yeah, so you have to have a laptop. Okay, it's advisable to have two monitors. If you have two monitors, that would be better because one is like you're looking at the patient, the other one is like you can type your electronic medical record. A quiet room or a quiet office. Okay, and I think number 4, I discussed this a bit extensively, and you can decide which platforms that you will decide to use, especially for those who haven't adapted to this kind of practice. Okay, so of course improve your IT skills. Okay, so this is, I think, a minute of your time. So that's from the Canadian Medical Association. I won't discuss it. Maybe reserve it if you have any Q&A or question for that. But there are many information regarding website manner online. Okay, so as I finish this discussion, there are challenges to telemedicine, and I talk about the benefit of this to the patient. But I think what is interesting is that with this study from the European Telemedicine Journal, is that the acceptance rate, okay, for healthcare professional is quite low. Okay, but this is a study done a couple of years ago, and would be interesting if there are any collaborators in the future to see the acceptance rate of Tele-Konsulta for health professionals in the times of pandemic. Okay, in a situation where you cannot see your patient, or you don't want your patient to be in harm's way because it's lockdown or quarantine. So I would be interested to see a follow-up of this research, or a research similar done in other countries. I've not seen a particular research done in the Philippines. If you know, please contact me, and I'll be happy to read that article or journal. Okay, so I think this is the last question. Okay, so Paul Eve, can you go quickly to Paul Eve? Okay, that's POLLEV.com. Okay, so this is already activated. Okay, I'll give you 10 seconds if you can answer, and then I'll show the response. Okay, so in the US, the adverse outcome of Tele-Konsulta, okay, the major cause of this death is due to, let's see the response. Okay, so, okay, people are still answering, but based on the data, that we have, it is because of delayed diagnosis. Very important. Like for example, case of just abdominal pain is actually appendicitis. So you don't want that to rupture. Okay, if there's any delayed diagnosis, it will complicate the management and the treatment. Okay, so thank you for those who are answering. It's basically delayed diagnosis. This is for US. This is for US data. Okay, so I have two more questions. I'll go very fast.
Oo nga, sige. Sabihan ko siya.
Okay, so
Thank you.
okay, I can hear some people in the background. Okay, so what are the things that you need to document in your teleconsulta? Okay, so all medical appointment, patient information, chief complaint, is the referral, the management follow-up. What are the things that you need to document in teleconsulta? Okay, again, for the interest of time, I'll just show the response very quickly. Okay, I think some of you are trying to answer all, but not possible. I think that's the limitation of the platform that I use. But to be, again, for the interest of time, the correct answer is all. Okay, you have to document everything from the booking. If it's a call because it's a telephone consultation. Okay,
Hello?
patient information, the ID, the chief complaint. These are the things. So again, everything you have to
Pero 4 million pesos naman.
Hello, Dr. Eugene. Hi. Hello?
So
Can you hear me?
I'll finish this and then I'll allow the to join.
Pero
So
Go ahead, doctor.
yeah, so I think I'll stop there. Just give me a minute to a second. So thank you very much. These are my sources. And thank you very much for indulging me. Of course, I went beyond my time again and I apologize.